Welcome to our Community Health Partnership sponsored podcast, where CEO Dr. Sue O'Connell and James Vaughan, our National Lead for Partner and Engagement, will discuss the community estate challenges and response during COVID, our lessons learned, and what this means for the future estate. Sue, if I can come to you first. We've heard a lot about the impact of COVID on hospitals. Can you share what's happened out of hospital? What were the challenges and how did CHP respond?
Yes, thank you, Nancy. And our response was based around three basic requests from the NHS. The first one was to establish community hot hubs in some of our 309 buildings. We were asked to convert around 50 of our buildings into these hot hubs, and the timing to do this was all incredibly tight because of the emergency, and we had them up and running in around 3 to 4 days of the request. The second type of request was more major reconfigurations of some of our buildings. Good example was changing a non-bedded community hub into a 75-bedded COVID-19 recovery centre, and among the challenges were the lifts were not big enough to take a standard hospital bed, but we managed to transform that in around 3 weeks. And thirdly, it was a request for space in our buildings to allow the shift of services out of hospitals into the community. We were able to respond and get things moving really quickly because of the level of data we hold and the skills and expertise and responsiveness of our LIFT joint venture and our FM partners. And the FM was mainly around the additional cleaning and security needed. The main learning from all this was when everyone really works together in partnership to deliver, we can do it. And we were so proud to try to do it to support the NHS.
James, you work closely with our NHS partners, especially CCGs, STPs and ICSs. As we emerge from the crisis and return to more normal business, what were your sort of observations and lessons learned from COVID?
Thanks, Nancy. Perhaps the most significant change was collaboration and the need for everybody to pull together and pull in the same direction. Service moves and building operations being agreed more quickly than I've ever experienced. And historical system and organizational barriers disappeared overnight. Technology, there was a major shift to online and phone consultations in primary care. This happened overnight, with 90% of GP contacts pre-COVID being face-to-face, and at the height of the pandemic, this has shifted to 90% being done remotely, which is now having an impact on the future thinking around the states of the future and how GP services will be delivered in moving forward. And pace. Sue mentioned around pace earlier on, but actually the pandemic tested our LIFCOs, requiring them and many others' ability to respond in an ever-changing environment. And to quote one of our NHS colleagues, we have achieved more transformation in the past 6 weeks than we did in the past 10 years.
So we're hearing a really strong message from our partners then that they don't want to go back to old ways of working. That they really want to embed the rapid transformation of service delivery. So what does this mean for the future of community-based healthcare estate? James, what are you hearing from our partners and how is CHP helping?
A key area we're getting back at the moment is around utilisation across the whole estate, for them is a burning platform using what we've got better. This links closely to owning shared objectives for optimising the estate to enable flexible accommodation, making buildings technology enabled, providing data to make decisions which will result in full and efficient utilisation of space, maximising delivery of patient throughput through our best-in-class estate, and enabling delivery of new service models, and delivering efficiencies and focusing on the cost per patient episode, enabling the NHS to demonstrate value for money. This all goes hand in hand with service transformation and sustainable change. The task ahead is to bring digital and physical infrastructure together and aligning them to workforce transformation to support service change.
And Sue, final thoughts on the future estate from you?
I suppose there are two questions in my mind, I think. One is, will the drive for service transformation and the rebalancing of activity across hospitals and the in-community sectors that we've seen as a result of COVID be sustained and result in the ambitions of the long-term plan being realised, and in doing so also increase the resilience of both settings? And I think the other question is, of course, around financing. We don't know what the comprehensive spending review is going to look like in terms of funding for community estate, but if that transformation we've just been talking about is to be embedded, it will need more money spending on the community estate. And I suppose the question I have is that historically private sector funding has played a significant part in developing these higher number but lower value projects. And as public sector funding gets tighter again, is there a case for a blend of funding going forward?
Some interesting questions to end with there for future discussion. So for now, thank you, Sue. Thank you, James. Thank you for listening. Hope you found this podcast useful. If you'd like to learn more about CHP and our infrastructure expertise, please visit our website, communityhealthpartnerships.co.uk.